Welcome back, folks. Joining us now is Dr. Jeff Davenport, founder and a physician at One Focus Medical. Dr. Davenport, thank you so much for being here today. Let's start off by talking about your family primary care facility. Explain it to us.
It's actually very simple. One Focus, we're trying to move the focus back to patient care, and so we're trying to eliminate all of the interference from multiple areas, specifically insurance, time restraints, and then try to move those things out of the way so that we can get back to just interacting with the patient.
So explain to me how the membership works. What does it mean to have a health membership?
It's pretty simple. Actually, I do describe it as a gym membership many times to patients. You just pay a simple monthly fee, and then all of our services are covered at that point. We don't file insurance or collect co-pays or any fees at the time of service, unless perhaps there are some low-cost lab work or generic medications which we dispense out of the office at cost. We're not trying to generate any income off of those lab and medications, but just the monthly fee, and you got us 24/7 actually.
A lot of our viewers at home right now are watching saying, well, this is fantastic, why can't I do this? So why are more doctors not doing this?
Well, you know, I've thought about that. I think perhaps fear is one thing, and then habit is another. We've been doing it the way we've been doing it for so long, it's hard to break out of that rut. And then there's a lot of physicians who don't recognize, as Dr. Smith was saying, there's a lot of demand out there to do things differently. And I just think we have to have more of them that are courageous enough to step out and do it.
Do you think what you're doing will have an impact and help make healthcare more affordable in the future? Is this a direction that's going to increase patient opportunities?
Honestly, I really have no doubt of that. I believe the most cost-effective factor in medicine is a primary care doctor who has time to take care of their patients. Time constraints are just going to urgent care after hours, and I don't have time to take care of that. I'll refer you to a specialist. Primary care doctors have a lot of skills that they don't use because they simply don't have the time.
So let's talk about time and the opportunity for patients just a little bit more. Since you all started One Focus Medical, what has the growth been like? What kind of, you mentioned the word demand. Are you seeing so much demand that you're trying to expand and meet everyone's needs? That's
really my hope in the long run. One of the characteristics of my particular practice is each provider only takes 600 patients, unlike the average of 3,000 for most primary care providers. And so we will need new physicians, and we will be expanding relatively soon, I believe. Currently, we've only been open since April 1st, and we have 250 or so folks.
So you mentioned before fear from other doctors, and it's a pretty big hill to climb to get past what you've traditionally always done. That leads me to think there must be opposition. You had to have heard of opposition or others trying to scare people away from your memberships. Is that true, or am I misreading that?
It's very interesting. I've had at least one or two physicians just tell me directly, this won't work. But I think the majority of physicians, especially the physicians my age, some of the younger people who know that we're going to be doing this still for decades, and we don't like the way we're doing it now, I think they're all very interested. They want me to succeed because they want to see themselves having a way out in the future where they don't have to keep doing what they're doing currently, which is 15-minute visits and running people through so fast, and patients don't like that either.
So let's talk about our medical schools, because I know the state is focused on how do we train and have more doctors in the state, and how do we keep them in the state. So for having gone through and become a physician yourself, are we teaching this type of practice to medicine? Are we opening that door, or do we need to reapproach how we're introducing folks to the industry?
Actually, the funny thing is in medical school, you're taught to take a lot of time with the patient, and then as a third and fourth year student, and then in residency, you're very quickly taught you don't have time to do that. And so I'm hoping that the way we're taught in medical school will be the practices of the future here in the state. I've actually even had some very young people, including young people who are just now starting their residency. They've heard about me and they call me and they say, I want to do what you're doing when I graduate. Can you teach me? And so I do believe the future is going to be much more along the lines of much more time for care.
So for our viewers at home that are watching and they're saying, hey, this sounds great, I want to learn more or get involved, where can they go to find out information, or how can they get involved in your program?
Actually, the easiest way about learning about our practice is simply go to the website, which is www.onefocusmedical.com, and it's the word one, focusmedical.com.
Dr. Davenport, thank you so much for being here. Really appreciate your time.
Thank you.